In this video, I'm going to show you how to look up a code using the ICD-10-CM manual. Hey there, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. Today I'm going to show you how to use the ICD-10-CM manual for basic code lookup. If you're new to my channel, I post all kinds of helpful content like this all the time, so you might want to make sure that you subscribe and hit that notification bell so that you can get alerts when I post new episodes. So for those of you who are not yet familiar with medical coding is that process of reviewing medical records, taking all of the different diseases, disorders, procedures, services, equipment, and then translating them into different code sets. This is a critical step in health information management and can impact everything from billing and insurance claims to research and budgeting for healthcare costs. So if you're researching medical coding or you're just starting out in your journey and you want to know how to do a basic code lookup for ICD-10-CM, stick around because I've got you covered. By the way, if you finish this video and you want to learn a lot more about medical coding, salary expectations, what certifications you need to prepare for, what the job outlook is, and things like how you can get the best training possible for medical coding and be job ready in 6 months or less without going into student loan debt, like I have a whole masterclass that covers all of that. It just takes out all of that guesswork and gives you that full roadmap of you need to check off this box, this box, this box, and this box. And then I tell you about the best training program out there that will check off all of those boxes. So definitely go and check it out. The link is in the description below. So this is the version of the ICD-10-CM manual that I use. There are different versions by different publishers. So some may have guidelines in different locations. Some may have different illustrations or thought maps that are included. I like the AAPC version for the CPC exam. I think it is the best one for CPC. If you want to see a review of just kind of how to use the ICD-10-CM manual, I have a whole video for that. But today we're just going to go over like 5 different examples of looking up medical codes. And definitely let me know in the comments if you would also like me to make a video on the main term and how, when we're looking at a diagnosis, we determine what is that main term that we're going to look up. So the first diagnosis I want to start with is keloid scar. A keloid is an overgrowth of scar tissue. Sometimes it can be kind of wide or thick or bulge out or be kind of hardened. So when we look up our code, we're going to start in our alphabetic index. In most versions, that's in the front of the book. Some of them have it differently though, but most of them they're in the front. There are always those odd versions out there. So we're going to start under our S's and we're going to look for the word scar. So where is our scar? We have scabs, we have scalp, we have scar. And then we go to our next indentation to further define what kind of scar is it. This would be our default code for a scar, but we have a keloid scar. So we're looking specifically for a code for keloid. So if we go down to our next indentation, let's see if we can find keloid. Nope, we go to our next page and see if we can find something that says keloid. Okay, so here we go. Keloid scar, it says, is L91.0. So we never code directly off of the alphabetic index. We always verify it in the tabular list. They go hand in hand. So the tabular list is mostly in alphabetical order, except for our chapter 22 is not in alphabetical order because those are our U codes. They don't come in the right alphabetical order. It's only, I believe, two different categories of codes. One right now is, I think, for vaping. The other is COVID-19. But in any case, we're going to look for our L's. So LMNOP, we're at M, we're a little too far. Sometimes when you're learning, it's helpful to keep some scrap paper by, just in case you start flipping through pages and then you can't remember some of the digits, like you get here and you're like, oh, it was L something, and now I can't remember it's what the rest of the digits are. So keeping some scrap paper by just to kind of jot that down in case you don't want to flip back and forth, that can help you out when you're just kind of trying to remember what you're doing. So here is our L90, we're at L91. L91, so the first 3 digits of an ICD-10-CM code is referred to as the category. So the category for L91 is hypertrophic disorders of the skin, and we're looking for the L91.0. So here is our L91.0. It's the hypertrophic scar, and it says even here keloid and keloid scar. Now we have to pay attention to any of these other guidelines here. Make sure that there's not something we're also supposed to include, like maybe it wants us to include a wound code first or something, but in this case, it doesn't give us that directive. So if we're just looking for the keloid scar, it does say it includes acne keloid and it excludes scar NOS, or not otherwise specified. So if we were looking for these codes, we would want to maybe code this instead, but we are right where we're supposed to be. We have the keloid scar, so L9 1.0. There's no icon here saying we need additional characters, so that'll do it. It's just the L9 1.0. Next, we'll try UTI. UTI is urinary tract infection. So when we see something like a urinary tract infection, we need to figure out our main term, right? So oftentimes it's not a location that we want to look up. So let's say for heart attack, we don't want to look up heart with the location of it. We want to look up the word attack. And in the case of something like urinary tract infection, we're not going to look up urinary tract. We're going to start with what's the condition of the urinary tract. Well, it's infected. So we're going to look up the word infection. All right, so we're under this term infection. You can double check where you are because the title of the alphabetic word will be right up here. So we're looking for infection and we're looking under our next indentation. You can use these nice yellow guidelines to look for the next indentation for urinary tract. So let's see if we can find it. Here we go. Urinary tract. Now there's a couple other further indentions in here. You can, again, these nice yellow lines help you kind of navigate that you're at the right spot. And ours is just a general UTI. It didn't say, you know, complicating pregnancy or that it was a kidney infection or anything like that. So we're going to use this general code, the default code it says too, which is N39.0. Okay, so here's our category N39, other disorders of urinary system, and here's our N39.0, urinary tract infection, site not specified. Now, it also tells us to use an additional code to identify the infectious agent. Now, for this case, we're just kind of doing the general UTI code. We don't have information in regards to the infectious agent. And sometimes they'll give you a little information about, you know, what additional code to use. So here it tells us use something from categories B95 through B97 to identify the infectious agent. But in this case, we're just coding the UTI, urinary tract infection, site not specified. We don't need any additional characters, so we're going to go ahead with the N39.0. Now, what if we're looking for lower back pain? Remember what I talked about with the location? We're not going to look up that anatomical location. We're going to go with what is the condition of that anatomical location. It's in pain. So pain is the term that we're going to look up. So we're going to start in our alphabetic index under P for pain. As you can see, there's a lot of different codes for pain because you can have pain just about anywhere in your body. So it's broken down by a lot of different body areas. So here we have pain abdominal, acute. Let's see if we have back on here or if we need to flip our page. There we go. So pain for the back, this is postural, so M54.9. That doesn't seem quite right though. One other thing we could do is, you know, lower back pain is often referred to as lumbago, but let's see if we have something maybe that says lower back. Okay, so we do have here lumbar region. It maps to M54.50. And then actually, if we go down here, there is also, if I can get it down far enough, low back pain, if we see here, and it's the same code, M54.50. So let's take a look at that code. All right, and here we are, low back pain. It says we need our fifth character, which was our M54.50. We don't need any additional characters beyond that. Low back pain, unspecified. Loin pain or lumbago, not otherwise specified, so that would be our code. When we kind of look at it though, you can see here it's got this like black dot on it. Your legend is at the bottom of your book for the AAPC version. Some of them may have them different, but usually they're at the bottom. And that tells us that this is actually a new code for 2022. If you noticed, it was also highlighted in yellow, which means that it is an unspecified code. Now let's kind of take it one step further, but go back to our pain codes. So what if we have bilateral hip pain? So we're going to go back to our P for pain, right? But when we go to our P for pain and we look under H for hip, there's nothing there. But thankfully, if we just go down a little bit further, oh my gosh, it's under joint hip. So remember that the hip is technically a joint, so that's where they have it under J for joint and then H for hip. And that's going to take us to M25.55. Now there's this little checkbox here, and that checkbox means that we're going to need some additional characters. Probably either a bilateral code, or we're going to have to see like when we get there. So M25.55, we're going to go to our tabular list. Okay, so here we are. We've got M25.55, and it tells us we need a 6th character, and pain in the hip, and we have right hip, we have left hip, and we have unspecified. But this patient has bilateral hip pain. So what does that mean? Well, since there's no code for bilateral specifically, are we going to use the unspecified? No, because they did specify. They specified bilateral. Bilateral means it's in the right and the left. So in that case, we're actually going to use 2 codes to encompass the bilateral hip pain, M25.551 and M25.552. to encompass that it is a bilateral hip pain. So we have to code 2 codes because there isn't one for bilateral. Now I know ICD-10-CM is the International Classification of Diseases, but it's sometimes also things like reasons for an encounter or things that impact healthcare services. So what if we're coding for something like an encounter for an insulin pump titration? Well, we actually look up under our E for encounter. You might want to, sometimes it's just good to look at all the different stuff that's in the alphabetic index, not to memorize them, but just to kind of like get familiar with what some of the contents are. So if you see something, it might kind of jog your memory and go, oh, you know what? I remember when I was flipping through my book the one day, I was surprised that I saw a, homelessness as an ICD-10-CM code. So it just kind of gets that familiarity level in there. So let's see, we have encounter, and we're going to look for maybe insulin pump. You see there's a lot of different encounters for blood typing, breast implant exchange, counseling, expectant parent, fitting and adjustment. It tells you to see fitting and adjustment, and instruction in childbirth. And we're looking for an insulin pump. Well, there it is, the very bottom of the page. Insulin pump titration, Z46.81. All right, there we are, Z46.81. Encounter for fitting and adjustment of insulin pump, encounter for insulin pump instruction and training, or encounter for insulin pump titration. So that's right, what we're doing, right? So Z46.81 is for the encounter for insulin pump titration. So I hope you found this video helpful. Definitely let me know if you want me to do more of these just walkthrough style of basic cases, intermediate cases, complex cases. Just let me know in the comments below what you're thinking. And if this convinced you that you want to take the next step and learn more about medical coding, because this is very, very, very bottom basic level stuff. There's a lot more complex, cool things to learn about medical coding. Definitely check that link for my training, my masterclass in the comments and in the description below. I will see you guys in the next video, and until then, just keep on coding on.